Hello and welcome to Chapter 33, Part 1. So we're only going to page 863, and you will stop before sterile field for your reading and for lecture. Looking at learning objectives, we're going to define, spell, and pronounce the terms listed in the vocabulary, define the concepts of aseptic technique, explain the differences between sanitation, disinfection, and sterilization. And I know you guys know this one now because we've been going over it for a long time. And I had you email me last week, so keep it up. Summarize tips for improving autoclave techniques, demonstrate how to prepare items for the autoclave sterilization, explain how to wrap materials, and discuss the types and uses of sterilization indicators. Summarize the correct method of loading and operating and also unloading an autoclave. Summarize common minor surgical procedures. Detail the medical assistant's role in minor office surgery. Explain how to perform skin prep for surgery and how to perform a surgical hand scrub. And be able to outline the rules for setting up and maintaining a sterile field. This is so important. We talked in lab last week about what the ramifications are if we break a sterile field and then cause an infection for our patient. In this, we need to be able to open a sterile pack, create a sterile field, transfer sterile instruments and pour solutions into sterile field, and demonstrate how to apply sterile gloves without contaminating them. Discuss how to assist the physician during surgery and demonstrate how to assist with a minor surgical procedure and suturing. Summarize post-operative instructions and explain how to remove sutures and surgical staples. Explain the process of wound healing and explain how to properly apply dressings and bandages to the surgical sites. And finally, conduct patient education in aseptic technique and surgical procedures and discuss the legal and ethical concerns regarding surgical asepsis and infection control. Let's start here with surgical asepsis. Everything that comes in contact with the patient must be sterile, including gowns, drapes, and instruments, in addition to the gloved hands of the surgeon and the surgical assistant. Single-use disposable items offer the best method of infection control, and they are being used more frequently in medical offices. We did talk about how this can be a cost issue with smaller offices, so it's important that if you are using autoclaves and using all of your own surgical tools, that you are very clear and that you maintain the autoclave correctly. So what is sanitation? Sanitation is the cleansing process that reduces the number of microorganisms to a safe level as dictated by public health guidelines. What is disinfection? It is the process of killing pathogenic organisms or rendering them inactive by physical or chemical means. And finally, what is sterilization? It is the destruction of all microorganisms. Sterilization can be achieved by moist heat in an autoclave, by gas, or with chemicals. Clean section of the utility room is reserved only for sterile items that they're in the clean plastic bags that are used to store the sterile packs as well. So we want to make sure that we also know how to store our autoclaved items correctly. This is a picture of an autoclave. It looks very similar to one that you have in our lab and that you will be using throughout the course. And this causes steam under pressure, which kills all pathogens and spores, right? Because we're sterilizing. Pressurized steam is fast, convenient, and dependable, and you will see most offices, actually probably all, unless they only use the pre-filled packs, all offices should have an autoclave. So there are 3 basic autoclave cycles, and there's a gravity fast exhaust cycle, a liquid slow exhaust cycle, and a pre-vacuum cycle. We're going to run ours when we practice on the normal cycles there, and it's important in whatever office that you work in that you get to know the autoclave, that you read the book, and that you work with your trainer to make sure that you understand how to use your specific autoclave. In here, you can find in your book on table 3.1 common factors influencing the effectiveness of the sterilization, and please be familiar with this as well. So incomplete sterilization, steam that is too wet or too dry does not work properly, and then the tools are not sterilized. Presence of residual air means that there is incomplete sterilization as well. Some common causes of wet steam are if the packs become too saturated to dry during the drying cycle. The packs pick up and absorb bacteria from the air or any surface on which they are placed after removal from the autoclave. So placing cold instruments in a hot chamber also increases condensation. Other causes of wet steam include opening the door too wide at the end of the cycle or allowing a rush of cold air into the chamber. Also overfilling the water reservoir. So it's important that you only fill to the fill mark. You can look at table 33.2 for tips to improve the autoclave techniques in your book. Wrapping materials. So maintenance of sterility depends completely on the wrapper and the method of wrapping. So it's very important that you understand how to do your wrapping, that you watch the video that I ask you to watch. It's great. And then you can even practice. You're welcome to take home a couple of our blue wraps and practice with them. It's pretty simple once you get the hang of it, but it's very important that you do it correctly. And the material we use is permeable to steam, but impervious to contaminants, and that is the blue wrap that we use does qualify for that. So clean muslin, disposable autoclave paper, and polypropylene bags are examples of autoclave instrument wraps. We will also teach you how to utilize the autoclave bags in addition to the wraps, so you'll know how to use both. Whether you are wrapping an item for one time or many items together on a tray as a surgical pack, the procedure is the same. So be sure the wrapper is large enough to cover the items to be sterilized. This is very important. Inspect the wrappers for holes before use. Open hinge instruments. Place a gauze sponge at the tip of sharp instruments. Place a double folded towel on the tray first. Materials in the polypropylene can take longer to autoclave, so it's important that you use the correct settings. Place instruments into the bag so that the handle faces out when the bag is open. That's very important because the bag is opened with the peel down, and you do not want the sharp objects on that side because obviously when you go to drop, you could injure yourself. And it's also important to label the wrapper package according to contents, date, and initials. So you want to make sure that everyone has. And then I'll also teach you that in many places you will count the expiration dates depending on the protocol of your office, times 3 months or times 6 months, and write the expiration that it would expire. This makes it easier for the person who is monitoring and going through and checking to make sure that certain things need to be re-autoclaved if they haven't been used before the expiration date. We will use sterilization indicators. There are chemical sterilization indicators that include autoclave tape, which changes color when exposed to steam, which we have. And then the biologic sterilization indicators include pore strip indicators and test indicator kits. We have the strips for the plastic autoclave packs, and I will show you how those work in class as well. I'll explain it here though. So the way that they work is the test indicator kits are available that use ampules, which we're not going to use the actual ampule one, but we are going to use the strip that changes the color on the tab so that you know that the autoclave has worked and heated to the proper amount. It's important to keep quality assurance records, and this is true throughout all of our different lab procedures and machines that we use. Each office should have specific protocols to evaluate the quality assurance of autoclaving. I will share that with Sutter, we had a whole department that took care of this, and they came around. They were the quality assurance department, but when you are in a smaller office, it's really important to keep your logs. And we still had the log when we opened new packs of things and did separate things, and then they would come in and check and do their quality control, log their stuff, and make sure that everything was working correctly. What should be included in the report when the sterilization test has inadequate results? This is really important. The report should identify the nature of the problem and how and when it was corrected. The report should also contain proof of correction by indicating the date and time of a first, subsequent, and successful sterilization run before it is used again for office use. And again, we need to keep the logs and file the report for any failed tests. This will be protocol depending on what office you're in. We'll change the protocol on exactly how you go about doing that. So loading the autoclave, it's important to prepare all the packs and arrange and load in a way that allows maximum circulation of steam and heat. So you don't want to stack a whole bunch of them on top of each other so that they can't get the circulation. Rest articles on edges and don't crowd. Place the packs in racks, wrap jars, bottles, trays, and place on their sides. And there's no need to wrap if the item does not have to be sterile afterwards. So sometimes we just put something in there to sterilize it, to clean it for that one time, but it's not used specifically for sterile processes. Then you can just kind of throw it in there with the other ones and it doesn't have to be wrapped. For example, let's talk about vaginal speculums. They do not need to be sterilized for use. The vagina is a body cavity that is naturally open to the external environment. They must be sanitized, disinfected, and sterilized to prevent cross-contamination among patients. Okay, so we can put them in there. And again, a lot of times offices will just put them through the sterilization process. But in this case, they don't need to be sterilized for use in the packets, and you can run it through the sterilization and then put it, of course you wouldn't handle it without gloves and keeping it sanitized and disinfected, right? But again, most offices will just go ahead and put it through in a sterile pack so that you know that that is taken care of, because it is going into a body cavity. So my preference is to still put it into a sterile pack, autoclave it, sterilize it, and document on your sterile pack all the normal things that you would do. So what reasons might indicate proper sterilization did not occur? So any load that fails to convert a sterilization indicator strip, any loads processed after a biologic test indicates that the autoclave is not working properly, and any other signs that it didn't run its full cycle, or that the autoclave did not perform in the manner in which it should. So once the pressure gauge reads the 0, you need to stand back from the door and with a heat-resistant glove or a heat-resistant towel, you can open the door approximately a 1/4 inch. So it's just a little bit. There will be some steam that comes out, and you want to keep it that way and allow to air dry for usually 15 to 20 minutes. And then you still want to make sure when you go in to remove the packets that they aren't too hot. So you can have the gloves available or the towel. You want to stand behind the door when you open it because, again, some of the steam might come out. And if at any time the sterilization is in question, you want to